The ARorthopaedicGoniometer App is medical software aimed for orthopedic surgeons, physicians, physical therapists and veterinarians, providing tools that allow doctors to determine the most accurate possibly way and live images directly from the camera and space angles, thus estimating easily range of motion. By marking 3 points by touching over with the phone screen, a colorful sphere is printed in augmented reality each time while seeing the joint of the patient in screen. Angle values are printed sequentially after measurement on the screen, while you can continue measuring and choosing another set of 3 new points of interest by easily grabbing the last 2 points of measurement without losing their last positions. By ordering the patient to place his extremity in new position, you can register while seeing the last measurement in space in augmented reality. Point tip sphere is the target cross from which the spheres appears during registration each time the screen is touched. The positional calibration of pointer tip sphere in AR can be easily done by allowing the user to adjust the Z position of the pointer tip sphere by pressing the directions buttons accordingly. This feature enhanced the accuracy of sphere placement during measurement over joints in augmented reality, AR. In case the user needs to measure more accurate the range of motion, the following method is offered. First, the case iPhone probe tool, SIPT. A device dedicated for surface registration should be 3D printed after downloading the appropriate 3D files according to user's iPhone model from developer's site. The device consists of the case, in which the iPhone sits, and the rod. Rod has a predefined length, 25 cm, and it is attached perpendicular to the phone's case. The other side of the rod is the side that acts as mechanical pointer tip location. The pointer tip sphere in augmented reality, AR, by the app should coincide with the mechanical pointer tip location of the rod in order to measure accurate. For achieving maximum accuracy possible, which is influenced by user's dimensions iPhone device, the following a calibration maneuver should be done. By simply pressing the directions buttons over the screen, the XYZ position of pointer tip sphere in augmented reality are adjusted accordingly, aiming the pointer tip sphere in AR to be aligned in all dimensions and coincide over the mechanical pointer tip location of the rod of the iPhone in case. By default, the distance of point tip sphere is 25 centimeters away from camera, Z. By pressing the plus or button, the distance is adjusted respectively. In the intermediate row, the plus button adjusts the X distance of point tip sphere to camera in space. In the last row, by pressing the plus or button, the Y value from the point tip sphere in space to the camera is adjusted likewise. The spheres can be changed in size, R, adjusted by pressing or plus button accordingly, or color for better handling of the points and helping physician to differentiate between 2 different measurements, flexion and extension, or external rotation versus internal. Save the measured values and results as a screenshot to the photo roll for later review or consultation.